Stroke Awareness in My Community by Dave Bannicky. So, to tell you a little bit about myself, I have lived in my community for a couple years, specifically the one that I'm using for this presentation. Aside from that, I've lived around the area of my chosen community. My hospital recently became stroke certified, roughly a year and a half ago. I've currently been a nurse for just over 2 years now. Aside from that, I was a new nurse when we were becoming stroke certified, using dangerous medications, worrying about the fear of, JCAHO questioning me, uh, with all that being at the forefront of my mind. I was fearful for taking stroke patients, but I am somebody who likes to tackle my fears, and so I run at it head on, learning as much as I can and trying to become the most proficient with that situation. Um, in this presentation, I will define my community, discuss my results, and my view on the community through my windshield survey. I will discuss my assessment data on my community as well as the partnership and resources I have acquired and that I will need to carry out my plan. After assessing my community and collecting data, I developed a community health diagnosis and from there devised a community health plan. My intervention has been set into place already at work. I've already started to receive feedback from evaluations from other nurses and some patients. And I'm starting on working towards education hospital wide. Defining my community. I believe anytime someone wants to make a difference, we should start in our own backyard. So the community I've chosen is just that, the city of Kenosha, where I live. Within the city of Kenosha, there are several subcategories you can see that are at increased risk for stroke due to different pathologies such as diabetes, abnormal clotting disorders, history of stroke or clots, hyperlipidemia, hypertension, atrial fibrillation. There's others who participate in risky behaviors such as drug and alcohol abuse, smoking, sedentary lifestyles. And then there's another category um, for other causes such as homelessness, elderly, being on birth control, and there are numerous causes. And in the emergency department, I have been seeing younger and younger patients having strokes. I have performed a windshield survey driving around the community of Kenosha. I've also done a little bit of research with the Census Bureau about Kenosha as well. We'll start off, I'll tell you a little bit about downtown Kenosha. Uh, this is where the majority of the festivals are. There's a large number of bars. There's a couple small mom and pop shops. There's a trolley that you can ride, museums. It gives you kind of an inner city, little Chicago, little Milwaukee type feel. There are many churches and bars spread out throughout the city, just west of that downtown area, which is right along Lake Michigan. You have a lot of run-down houses, homelessness, poverty, people who look like they're just getting by. Beyond there, if you continue west towards the interstate or anywhere past Green Bay, you will see large amounts of constructions, new buildings, homes, condos, communities. I guess they're building for the rising population. To the north and south, you'll see nicer homes where you can have an extremely large home right next to a smaller home where it appears people are living more comfortably instead of in poverty or just getting by. Um, there are a lot of grade schools, but there's also 6 local colleges and academies, as well as 5 colleges in the community. Um, with the Federal Census Bureau, I found out that 88.5% of people who live in the city of Kenosha have graduated high school or have a higher education. 22.9% of individuals from Kenosha have a bachelor's degree or higher, and 14% of people from the age of 5 or higher speak a language other than English. For recreation, there's the downtown area. There's some walking paths there. There's several dog parks, more to the north and south. There's biking trails again, more to the north and south, not so much. Um, there's not as much recreation in the middle of the community. There's a Boys and Girls Club down um, by the downtown area as well. Data assessment. For this, we're going to talk about housing, income, education, economy, health status, disease, and healthcare options. So all the following data was collected from the Census Bureau. Did a lot of work with, took a lot of data from them, as well as other research articles, which you can also see in my references. The following data was taken from 2012 to 2016. There, in Kenosha, about 56.1% of people from this community own their own homes, with the mean value of the homes being $141,400. Interestingly enough, the median value just across the interstate for the entire county of Kenosha increases by 21,000. So the median monthly mortgage is $1,423 per month. It's estimated that 37,511 households in the city of Kenosha have an average of 2.57 people per household. The education I already talked about earlier. There's 6 local high schools and academies. There are 5 colleges in Kenosha. Um, we talked about the percentage of people who speak other language other than English is 14%, and how many people have bachelor's degree, higher educations, being greater than 88.5%. 66% of the population age 16 and up comprise the workforce of Kenosha. 63% of that 66% are female workers. The mean travel time in this area for residents who live here is about 23.8 minutes. We do have lots of local stores. You have a section of, Hispanic stores. Downtown has the mom and pop shops we talked about. Um, there are also bigger things popping up on the west side like Costco, Sam's Club, Walmart. Um, what else? So there's lots of contracting jobs that are coming here with all the construction. Um, so yeah, the median household income is 49,636. With a per capita income of 24,253. There's approximately 19.3% of people in Kenosha are living in poverty, and that would be 1 for every 5 people you see. According to the survey, 90% of people from the community had insurance last year. 5% of the population had insurance for part of the year. 5% didn't have insurance at all last year. Around 12,000 people were uninsured. 99 1,000 people were employed or had employee-sponsored insurance. 5,000 people used private insurance. 29% or 29,000 used Medicaid, and 15,000 used Medicare. Roughly 3,000 had some kind of other insurance. Let's see, health status. There are lots of family practice facilities in the area. There's the two main hospitals, or three main hospitals, two being sister hospitals, the one downtown with St. Cat's and Aurora across the street. For 2017, there were 651 people who went to an STD clinic for treatment and diagnosis, which was up from 600 in the year 2016, so an increase in 51 there. The 2018 record has already shown 1,058 confirmed cases and treatments, so there's a large increase in STDs in the area. We're definitely lacking mental health facilities here in Kenosha. There are a number of other resources. We have medical and general health. Pretty much anywhere in Kenosha, it is about a 13 to 15 minute drive, and you can be at a hospital. Even less for a walk-in or clinic or doctor's office. The two main providers are Aurora and Froedtert. We have Froedtert South now. There are massage parlors and orthopedic clinics and chiropractors, dentists, pretty much shotgunned through the entire community, and that's about it for healthcare options. Partners and resources. Jason, who is my team lead at the ER I work at, and Shannon, the stroke coordinator, have been my partners throughout this project. Other resources that I have who are, the foot soldiers laying down the groundwork that I need to make the impact that I want are the nurses who work in the ER. Hopefully, eventually, it will be hospital-wide. But Shannon and Jason were both excellent resources. I look forward to working with them more in the future. Jason assisted in ensuring that I was able to educate nurses, help for the skills day with evaluation and education. Shannon invited me to a community health fair for stroke and aneurysm awareness, as well as helping with future implementations of current education. While we were there, we assisted at the community fair. We assisted with the carotid ultrasounds, taking blood pressures, drawing labs, education on food, colorectal screenings, assessing body fat index, and BMIs. So this job is too big for just me, which is again why I need these other nurses to help make that impact that I want. So my fellow ER nurses have learned of my proposal, and I have continued education with them. I've used volunteer hours to go through with nurses to evaluate risk factors and past medical history in patients' rooms as well as in triage. So the plan is to, as you will hear about later, my intervention is to start the talk. That's my plan, to start the talk. I want to start talking about stroke more, and I need other nurses to help. Therefore, they are my resource. For community health diagnoses, I've narrowed it down to 3. Those are ineffective knowledge about how other pathologies increase risk of stroke among those with comorbidities related to lack of education. Increased risk of stroke among those in the city of Kenosha related to unhealthy eating habits and sedentary lifestyle. And the last one is increased risk of stroke among the residents of Kenosha related to unhealthy lifestyles. These community health diagnoses are the major contributing factors to stroke in my community. Lack of knowledge is the easiest thing to fix as a nurse, as it is our job to educate. Patients needing that motivator to tell them they need to work out, they need to start making healthier lifestyle choices, lifestyle modifications. Stop using drugs, drinking alcohol, smoking, all these extra things in their life that increase the risk for stroke. They need that nudge, and there will be more of a conversation than just saying stop. They need in-depth details about the pathology, how it's harming them, and how their body is being affected, more than just stop. There will be more of a discussion on how harmful it is, how it can cause life-threatening and debilitating effects from the strokes that they can have. By educating and initiating the conversation to raise awareness and intellect, we can allow patients to have a better understanding of their health so they can make better medical decisions. The plan is to put the fire back into nurses to get them excited about educating patients again. It doesn't matter if we don't have the time. By educating patients, we can reduce the backup of patients coming in and overcrowding, I should say, of the ER. The plan is to empower patients to take care of their own medical care and make better decisions before the onset of symptoms. The plan is to start the talk. My intervention is short and sweet. Basically, start the talk. That is the premise of my intervention. There's a little bit more to it with understanding, pathologies that lead to stroke. But my project goal is based on the philosophy that education is the key. My goal is to educate patients on signs and symptoms of stroke, how strokes are treated, whether it's ischemic, hemorrhagic, thrombotic, the pathologies that increase their risk of stroke, such as hyperlipidemia, diabetes, sedentary lifestyles, stress, drug and alcohol abuse. The patient will also be asked questions related to exercise, how often they eat out, what they eat, what they believe to be healthy and not healthy. Education before symptoms occur is how we can prevent. We could take preventive measures uh, to reduce the risk of stroke. I am also assisting in education for Skills Day related to NIH stroke skills assessments, administration of TPA, which is the tissue plasminogen activator, the clot buster, and education on stroke charting. In the future, we'll be switching to Epic, hopefully fairly soon here, by the beginning of next year, maybe. And I would also like to be a super user for that as well, to ensure that there's better tracking with strokes. For the evaluation section, I have educated peers, I have educated patients, and done surveys and evaluations with both of them. I have had positive feedback from patients, and I have had both positive and skeptic uh, responses from nurses. Uh, so I've created the evaluation form that allows them to rate my educational material, the effectiveness of my education, uh, how well the material was presented. It also allows for constructive criticism. It's all completely anonymous. I've heard positive feedback from many nurses. I've also heard, like I said, the skeptical feedback stating that they think it's going to take too much time. They don't have enough time already as it is. Um, it's going to cause patients to become scared and want to be evaluated for a stroke every time they come in. And then I always stress the importance of proper education. Um, it's like having the talk about sex with your kids. Do you have the talk? Do you not have the talk? Knowledge is power, and I feel that you can't go wrong with educating patients. Uh, I've created a I've created a survey uh, that, if passed by the chain of command, I will assess the effectiveness. They'll assess the effectiveness of my training and rate the performance by the staff members. The survey is brief and will also ask them how they feel about their stroke knowledge uh, before and after the education was done. The survey will be passed out with stroke education material from Sunrise as well as Lippincott education. EdPi is the summary. All of these steps were completed to attempt to make a change in my community. I have determined that the city of Kenosha has an increased risk for stroke due to sedentary lifestyles, lack of knowledge, obesity, as well as drinking and drug use. I created a plan to take the weak links and run at it head on. This will lead to nurses becoming more well-rounded and in knowledge and education. The goal is to raise awareness, empower patients to make medical decisions and be informed about those decisions, and to take action in their care to help reduce risk of stroke.